So the real cost of being an associate isn't really on your pay stub. It's losing your voice or losing the clinical dentistry that you really wanted to do. And having owned a practice and doing a startup dental practice and now coming back to associate to see what the landscape is for dentistry is, I'm flooded with memories of being an associate dentist where I would suggest something and it was maybe heard, but it wasn't heard in passing and it wasn't implemented. It wasn't taken as seriously as if you were to suggest it for your own dental practice. So eventually, after a while, you start to become less vocal about what you see or what you do because this is not your practice, like this is their practice and this is how they want it to be done. And if you're not recognized for your suggestions, then it kind of erodes away your confidence in suggesting more things. Like you feel helpless that you can't change anything because you don't have authority or power within the practice. However, as a social dentist, every office is going to tell you that you should run the practice like it's your own, but it's truly not your own. And then you start detaching from your clinical self and what you would do better, So then the associate role, it after a while, after a few years of practice, the associate role really forms you into a different clinician than what you may have thought you would want it to be. So, having done associateship and then owning a startup practice, I really miss just being able to implement things really quickly and to see it work out. And it's just immediate gratification, honestly. It's like maybe sometimes that's the reason why some dentists go into the dental profession. It's because you can do like a filling, remove cavity, put a filling in, and it's immediate gratification. Or you can get a patient out of pain and get that tooth numb and reduce the pain level for like starting a root canal. And again, immediate gratification, right? So when I was able to implement protocols or systems in my dental practice, it was immediate gratification for me to see it working out and it made sense. So the lacking thing about being an associate dentist is that what you feel and think is correct and suggest isn't always heard by the owner. And over time, that forms you that forms you into a dentist that you might not want to be. So you'll be less spoken out, you'll be even quieter,